Is saving patients both time and money these days. One of the newer examples is balloon therapy, a procedure that often allows people with chronic sinus pain to feel better in minutes. CW33's Barry Carpenter is live with this story. Barry.
Amanda, time is money, and the healthcare industry is trying to save on both fronts these days. A good example of that is balloon therapy, which used to be performed largely in the hospital and cost a pretty penny at the time, but not anymore. Patients are now breathing easier for numerous reasons.
So we're just going to feel around for the right spot here.
Phil Schoenborn has suffered from sinus problems for years, and on this day is finally finding relief in the comfort of the doctor's office. He's undergoing balloon sinuplasty, which until last year was performed at a hospital under general anesthesia.
Cottonoid plug just out of your nose.
Dr. Rajit Pandit was among the first in the country to perform the procedure.
Feel it.
First in the hospital and now in his office. What used to cost $15,000 to $20,000 at the hospital now costs about $1,500 and saves Medicare $3,400 a procedure.
It's thousands of dollars less expensive to have the same procedure done in the office than in a surgery center, not to mention the fact that you don't have to take as much time off because you haven't had general anesthesia.
Maribel Alanis was among the first to have the in-office procedure last July. Her day was like any other day except for the procedure, which takes about an hour and a half.
That was the big benefit, just to be able to drive here at that late appointment and then be able to go home and still work in the morning.
That's because she and Phil underwent local anesthesia for the minimally invasive procedure. Dr. Pandit uses a catheter and high-tech balloon to dilate inflamed sinuses. It was so easy for Phil, he actually tweeted between nostrils. The squeamish, of course, can still have the procedure done in a hospital setting under general anesthesia, but Phil wonders why.
The fact that I don't have to stop, eating or fasting at a certain point the night before, wake up and be at a hospital in a hospital gown at like 5 a.m. and then knocked out during the procedure, taking, a few hours and then having to take time off work.
The procedure is so popular now that Dr. Pandit will soon move to a larger facility. As with any procedure, it's not for everyone, with bleeding a rare side effect. As for Phil, he and his insurance company can now breathe easier.
I feel great.
Barry Carpenter, CW33 News.